So I'm going to be bringing you guys four myths that are pretty common misconceptions when it comes to exercising and cardiovascular disease and then cardiovascular health in general. So the first myth is that exercise is not good for you if you have had or had uh, heart failure. Well, this isn't true because studies have shown that it's actually better if you start an exercise program after having a heart attack. A lot of doctors recommend doing this uh, because it's associated with improvement of outcomes for most patients. Um, the next one is being sedentary does more benefit for your heart than exercising it. Uh, a lot of people think this because it might, thinking about it, it might make sense. If you don't put any strain in your heart or you don't work your heart, it's gonna there's not gonna be any damage to it. It's the idea of running and doing some sort of exertion will actually damage the heart more. Well, this isn't true because uh, a lot of the reasons why you have shortness of breath or there might be uh, decondition is because they have the lack of regular exercise. And so exercising helps with shortness of breath. It makes your heart stronger, especially aerobic exercise training, and it improves circulation, reduces heart disease factors, and things like strengthens the heart as well as the cardiovascular system overall. The third myth is that you have to exercise a lot to improve your health. That's not true. According to the ACSM, you just have to do roughly around 30 minutes a day, 5 times a week, 5 to 7 times a week. This includes things like just regular walking, just a walk down to the park or down the road or doing 10 3 different bouts of 10-minute exercises. It's also good if you don't have the time to do 30 minutes for full complete hiking or cycling and things like that. Another thing is two studies in 2015 that show that like people who would go on just a daily walk improve their mortality. And a lot of time but the benefits will come if you do 20 to 30 minutes a day of just some sort of activity, get your heart moving. The fourth myth is cardiovascular disease only happens to those who do not have any form of exercise. It's not true. There's people that exercise, but they make unhealthy lifestyle choices, such as doing smoking, or having high blood pressure, things like diabetes, high cholesterol, sleep apnea, high sugar diets, and even genetics have a role to play when it comes to cardiovascular disease. But one of the best ways to prevent this is by using exercise as a prevention tool. So, and obviously avoiding things like smoking, and foods that will give you high blood pressure or diabetes, and although a sedentary life does contribute a lot to cardiovascular disease, there are many other things that affect it as well. Thank you.